Dr. Ibrahim Al-Balawy is going to present starting multidisciplinary neonatal stimulation program.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, ladies and gentlemen. Promise this lecture will be inshallah fast and easy, inshallah, away from all other technical aspects that you have started with today. So, starting multidisciplinary neonatal simulation program. When always we talk about starting something new and new innovative things in the colleges and departments, you will find a lot of obstacles and you find it is always difficult. So usually this is because of the fear and phobia of change, taking decisions, investing in something that you don't know how it's going to be effective or no. So here you have to go through these obstacles and to try to overcome it and overcome this resistance. So yeah, the difficult part is to believe in what you want to promote and to propose. Then you can move on. So just going back, and this was taken in 2009, and you can see there is me, and we were talking. I was lucky at this time when I went to the college to have only one Simman. It's called Simman 3G, one mannequin. We tried to manage and to do all our courses and to start with it, and it was really a good start. Yeah, it took us a while to promote this technology and to convince our high authorities about the importance of this. But it took us a long time. So after a while, I kept using this Simman for more than 6 years. And finally, this was taken like 2 months ago. This is our simulation center now. It's not big. It's around 6 or 7 rooms only, as you can see here. But it's doing the job for our college. So when we want to start a program, we need to do a need assessment first of all. What is good for us? What is good for our clients? What is good for our students or our trainees? We don't need to go sophisticated and thinking about 6 or 7 floors virtual hospital with all these fancy and highly tech equipment. No, we need to know what we need. So always homemade recipes. It's the best actually. So this is our control room also in the center. So, from where to start? The beginning also, always it should be from the evidence, taking evidence from the literature. We find out that simulation is very important and it's very effective. And you can see it's really used well in some disciplines like, I'm not talking now about allied health only on physicians and medicine. It's used in surgery very well, used in the basic life support, NRBs and different situations. It's well used there and it has big evidence and strong evidence to be used there. Also it's used for soft skills. We can use it for communication, for leadership and teamwork utilization as well. And it's all this supported from the literature. So from here you can start to bring your point ahead in front of high authorities that this evidence or this evolution and way of teaching, it's really supported by evidence. So what about neonatology? Is it used in simulation? Or should we use it in neonatology? Yes, we have 2 important factors actually that can support our decision to start a neonatology program. First one, it's that neonatology, they are working as a team. We have a multidisciplinary team in neonatology. It's not only about physicians or neonatologists. You have also midwifery, you have nurses, you have pediatricians, you have surgeons, anesthesiologists. A lot of big medical team can be all contributed in this program. So this will make your evidence more strong and your voice more vocal when you talk to to your high authorities. You need something that will help not only a certain discipline. No, you are here are going to help and other disciplines from physicians and different team and allied health works. The other thing that we always know that we don't want to put our infants in risk by training and actual bedside training. So simulators will help us to avoid this risk and provide a normal environment. As there are the different scenarios, yes. This was published in 2011, as you can see, and there is a bunch of scenarios that can be demonstrated in simulation, starting from airway management, giving some medications, and different scenarios for trimies and preterms and preemies as well. So yes, we can have a lot of scenarios that can we start with. And here, actually, it's much better to decide yourself, as we said, a ready-made home recipe. You know from your institution, from your place, what is good for your trainee. And from here you can start actually, to start with 1 or 2 scenarios. Don't make it sophisticated, don't make it difficult on yourself. I need to have a scenario that need a lot of mannequins, that need high technology, that needs great audiovisual systems. No, we just can start even with very simple scenarios like a communication skill scenario or breaking bad news scenarios. From here you can just start demonstrating this simulation, and you can show how the importance of simulation for your medical education. So as we mentioned here, that simulation should be realistic, interactive, and don't forget the part of fun. When we said about fun here, that you need to prepare your participants psychologically that this is a safe environment. It's a place where you can make faults, no risk will be there for your patient, for mannequins, so the interaction will be much better actually later on. So why integrate simulation? This study shows that the surveyors for educators and for manager directors in the hospitals, and the educators, they thought that their participants or their graduates are ready to work safely in the hospitals, and vice versa was shown in the other study from the other side, that the managers, they feel that they are not ready. So when you just mentioned that my students went through this training and simulation and they are ready, this will increase their readiness toward this toward their tasks. So here also you need to be aware about all the adult learning taxonomies and theories. So we can see here that simulations comes in the 75 part of practicing by doing, not only by lecturing and having these skills labs. Yes, again, academic concerns. This will be again the best thing for you. It's to have your home recipe. So you know your own needs, you know your own assessment, and you know how can you start with. Maybe you need, as we said, you start only with 2 or 3 scenarios, or even starting with a softer skills scenarios. Challenges, we went all through these challenges. Challenges can be started from, as we mentioned, budgeting. Yesterday we have a comment about one of the mannequin and how much it cost, and there was a big discussion about this. Yes, it might be costly, but always there is different approaches. You know, you can have some cooperation with different places. Companies sometimes can provide some mannequins for a short time. So once you get used to it and people know the importance of these simulation programs, maybe later on you can have better funds. And there is a lot of different problems, and one of the major problems also, it's staffing training. We have this big challenge of integrating to the curriculum and having the faculty members to be part of this. So we have to encourage people. We have to find more seminars, more workshops for them to go deep in the knowledge and the practice of simulation as well. To get started, you need to be systematic. You have to have your own goals and objectives. You need to know what is the design for your simulation that you are looking for. You need to create and test what you are doing. So it will start by strategic planning, then by implementation, and finally by testing. So as we can see here in this algorithm, you start with teaching tools. We don't need to go very sophisticated, as we mentioned. You don't need to go for the high-tech mannequins based on the simulation scenarios that you are looking for. You can go only for task trainers, you can use standardized patient, simulated patient, and sometimes scenario and web-based scenarios. So having these teaching tools, assessment tools, curriculum, and the curriculum, you have to be really focused on it because it needs to serve and help your learning objectives. Then you have to take the feedback, and don't forget always to submit, to support your scenarios and your program with evidence-based. Finally, you have to check by feedback and check the outcomes and to assess your progress here. So, to bring all the puzzle together, it's not only about simulators. We have instructors, curriculums, we have faculty, we have the students. All this puzzle should be together so we have the full picture of this program. So, usually when we start, you have to ask yourself a few questions. Okay, so how does your target audience learn? Based on, as we said, I cannot apply my experience in the college to the experience here in the hospital-based university or in different places. So we have to be careful about this. What is the best ways they can learn, and what is the goal for your experience? So again, it's much better always to have your own recipe for these simulations. So don't go far and try to make something very advanced. Let's start always with a simple scenarios that you can have a multidisciplinary team go through it and you can use it together. And the adults, we have to be aware about all the adults learning theories as well, the taxonomies here, like the Bloom taxonomy, and the different, the Miller, and how to move your participants from novice to expert. All these adult learning models and theories, you should go through it and you be aware of it. So again here, when we talk about the scenarios, and it's important, we have to make sure that what we are doing is very applicable and doable for our participants. And you have to ask yourself a few questions. One of the most important questions, does this task or this session should be repeatable? Or it's okay to do it from the first time. Let's say it's an intubation, difficult airway management. Do you think if that's your student or your learner, if he went through this scenario one time, this is going to be enough, or it should be repeatable? So we have to pay attention about these things before we design and doing our curriculums as well. So here, the goals should be smart and should be doable and easy to implement. We don't go for learning objectives and goals that cannot be reachable, and other obstacles can be in the way, like the budgets and the different things, or even the staff. And sometimes you will have big problems like having the problem of the scheduling. So sometimes if you cannot make the simulation part of your curriculum, you have to do it like an extra activity later on, and you have to schedule it and have spare time for it. So yes, and you have to check when you do your goals, is this task can be done alone, or it needs to be also with assistant and help? So repeatability, checking the importance of assistant, can be do alone. All of these will help you when you do your curriculum. So designing simulation, will be the last thing. You have, as we said before, to make sure that you have enough equipment or the replacement or from where you get it to prepare your participants, to prepare your learner. It will be a good idea also if you have someone who's a specialist for having the standardized patient trainer. So he would bring all your standardized patients and train them before they go to the sessions. Yeah, evidence-based, you can have a lot of resources nowadays. When we started in 2009, the resources was very limited, but now you can see we have different resources. This is in the UK based, this is in the US based, this is in Canadian based, and here this is also Canadian. This is a European based. All of these can give you a lot of information, guidelines, terminology, dictionary for simulation, how to start, for debriefing, for assessment of outcomes, how to write the scenarios. All these are good references and sources for all of these. And by the way, it will have also ready-made scenarios that you can use it and modify it based on your purposes and based on your needs. So after you prepare everything, just remember always that after implementation you have to test it. How should I bring students? Yes, I can bring students, learners, or even the faculty, and we run a scenario and check if this is can work or no. And after this, we can see what kind of improvement we have to go there, and to check the effectiveness actually of this simulation. So after planning, here putting the strategic planning, and after implementation, we have also to go and check for assessment at the end. So as a recommendation, before we start any program, just let's know what is our need and do have the assessment of need for our learners. We don't need to go very sophisticated. It will be also a good idea to have a collaboration with different agencies and affiliations with other simulation centers. And nowadays there is some simulation centers that's only specialized for neonatal and pediatrics simulation. So from here, using the expertise, using the resources, you can have a good program where you can start with, and you can overcome all over these challenges. And thank you so much. Any questions? Please.
Do you do the simulation scenario every week for your registrar and as it shows, or you do it like a workshop settings?
Okay, so thank you, Doctor, for this question. So we have here two scenarios when we started simulation. As we said, we said in 2009, this was only for the respiratory care students. So we integrated it in the curriculum, and we had it like weekly basis, as you said, and during the clinical days. Actually, we spare the time from the clinical days. For the remaining disciplines, we made it as a voluntary actually for them, because we are trying to involve them in simulation later on. So in our scenario, or in our case, it's totally different because we are allied health college. But when you talk about a university or hospital-based program, here it's totally different. Scheduling, especially, it's going to be a big problem for you, how you can schedule it. But how frequent you have to do it, again, it's based on your learning objectives.
Thank you.
Thanks, sir.
Thank you, Dr. Ibrahim.
Thank you so much.